4.
Okay, Ms. I just needed to wash my hands here, and now we'll continue on with the rest of our examination. I'm going to try to keep you as covered as possible. If at any point in time you feel uncomfortable or you would like something additional to cover up with, just let me know, okay? So the first thing I'm going to start with is to look at your head, okay? I need to examine your scalp, and I need to check your hair. I'm looking to make sure that everything on your head looks okay. Your scalp is actually just a little bit dry in some spots, but other than that, I don't see, drinking a lot of water, especially in the wintertime, is a good idea. It will help with some of that dry skin that you might have, okay? And so now what I'm going to do is to just look at your face. I'm checking to make sure that your face is symmetrical and that everything looks the same from side to side, that it doesn't look like you have any lesions or injuries or marks on your skin, and everything looks just beautiful. You very lovely young lady.
Thank you.
And now what I'm going to do is to ask you to do a couple of things for me. I need to check some cranial nerves in your body, and so I'm going to ask you to do a couple of things for me. First thing I'd like you to do is to raise your eyebrows up and down for me. There you go. And could you show me your teeth? There you go. That's very good. Can you purse your lips? And how about puff out your cheeks for me? Oh, you did that very well. I can't believe that you don't smoke. And how about, can you clench your jaw for me? There you go. And smile really big for me. There you go. That looks very nice. What I need to do now is to check your lymph glands. And your lymph glands tell me if you have any infections or illnesses going on right now.
Mm-hmm.
So the first set of, and you have lymph glands throughout your whole body, and the first set that I'm going to check are back here, and these are your occipital lymph glands, and they run back here in the back of your head. Then what I'm going to do is to check the ones around your ears. These are called pre-auricular, behind your ears, and these are post-auricular, in front of your ears here. And then of course your tonsils, everybody knows those. The lymph glands that go with your tonsils are under your neck area here. I can't feel anything at all. And then these in your jaw are called submandibular. And then you have some under the chin here that are called segmental lymph glands, and I can't feel anything, and that's a good thing, because if I felt them, that would mean you have an infection going on. So now what I need to do is to check your eyes. So I'm just going to open your eyes really large. I need to check the sclera of your eyes and the conjunctiva on your eyes. Your eyes look good. They're a little bit red. You've been getting enough sleep. You did say you had finals going on, so.
Just a little bit.
Yeah, I'm sure you're up a lot. Let me just go ahead. I need to mark down some of the information that I just got, so I just need to mark down what I got. Okay, so now, I told you before that we were checking the cranial nerves when I had you lifting your eyes up and down. Those were cranial nerve 7 that we were checking then. And now what we're going to do is we're going to check cranial nerves 3, 4, and 6. And those are cranial nerves that innervate into your eyes and into your ears. Okay? So what I would like you to just do for me is, hang on just a second, I need to get my little light here. And I'm going to go ahead and I'm going to ask you to do a couple of things for me to check your eye motion, okay? So first thing I'm going to do is I'm going to shine this light into your eye, okay? What I'll do, it gets kind of bright, and I'll bring it in from the side, and I'm looking to see if your eyes, you know, if the pupils dilate for me. There we go. And that's very good. Bring this one in. Oh yeah, your eyes, they're working really well. And now what I'm going to do is bring this one in over here, but rather than looking at the eye, we're looking at the other eye now. There we go. And then we're gonna, that's very good. Okay, now what I'm going to do now is to shine this light in the middle of your eyes right here, and I don't want you to do anything. You don't just look at a point over my shoulder. Don't look at the light, okay? All right. Okay. Your eyes seem to be working just fine there. Okay, I have a couple of more eye things that we need to do to check the cranial nerves. What I'm going to do is ask you to follow my finger. Okay, and so I'm going to move my finger in, you know, different patterns, and I'm going to ask you to just move with my finger. Okay, so here we go, and we're going to go. Very good. You did very well with those, and so I just have one more. You need to. Down. Okay, you did that very well. So that says to me that your eyes are working really well. Cranial nerves seem to be in perfect working order. I'm going to check your ears now. I'm going to look at this ear, and I'm going to feel back here. Can you tell me if that hurts when I push on that bone back there? That's the mastoid, and does it hurt when I push here?
No.
That's the tragus, and we're going to check the other one here, but first I need to check in both of your ears here. Use this little light. We want to see if you have any wax in there. I need to lift my glasses up because I can't see very well with them on. Boy, your ears are spotless. You have really clean ears there. You must do a really good job taking care of yourself. Oh, that ear looks really good too. Okay, so now we're going to feel on this side too. I just need to make sure that your ears are the same. You don't have one big ear and one little ear.
Yeah.
There we go. Okay. Your ear looks really good, and once again, can you tell me if it hurts back here?
It does not.
Okay, and then when I push on the tragus here,
okay,
that doesn't hurt either. Okay, very good. I'm glad to know that all that's going. Okay, so now what I need to do is to check your nose and your sinuses. Okay, do you get headaches very often?
Not too often.
Okay, sometimes do you get them with allergies or?
When allergy season hits, yeah, I get some headaches.
Sometimes it's because the sinuses get plugged up, and so I'm going to feel these sinuses here. These are frontal sinuses, and does that hurt when I push on that?
No.
And how about in here? These are called your maxillary sinuses. Does that hurt?
No.
Okay, very good. So what I want to do now is to check in your nose and check your mouth as well. I just need to check in the nostrils. And they look really good there. And the shape of your nose looks really good. You don't have a deviated septum, you know, where part of the nose is misaligned. Can you breathe in when I block this side? And try this side. Okay. All right, so now what I'm going to do is I need to get my tongue dispenser. There we are. Okay, let me get my tongue dispenser here for me. Okay. what I'm going to do is to open your mouth for me, and what I need to do again are check some more nerves. So can you say ah for me?
Ah.
Oh, that works really well. That is cranial nerve 9 and cranial nerve 10. That's the vagus nerve and the glossal. It's another, it has to do with your tongue.
Yeah.
But it's cranial nerves 9 and 10 that innervates. So what I need you to do now is to stick your tongue out for me. Oh, very good. Okay, now can you push with your tongue on the side of your cheek? And how about on this side? You got a very strong tongue there, young lady. Let me put these over here. There we go. Okay. So I think that your sinuses seem to be okay. Your nose is just fine. Your ears, it doesn't look like you have any problems there. What I'd like to do now is to check your neck and your shoulders. Okay. And so what I'm going to do first is to check some range of motion on your neck. Okay? So what I'd like to do is to have you show me if you can touch your chin to your chest. And how about bringing your ear to your shoulder, your left ear to your left shoulder, to your right shoulder. Are you able to take your neck in a circle? Does that feel good? Feels good to me. It's nice to relax the muscles there. If I push here on the side of your cheek, can you push against that for me and give me a little resistance? That was really good. How about on this side? You have a really strong cheek there. Okay, so that worked really well. I have a few more lymph nodes that I need to check here. And there are lymph nodes in the back here. These are post-auricular, I think that's the name of them. And then, actually that's not the name of them. I need to double check that one. And then I know these are your clavicular lymph nodes. These are the supraclavicular lymph nodes. And down here are your inferior clavicular lymph nodes, because this is your clavicle right here. So those feel just fine to me. So those all seem to be okay. And let me go ahead and just jot down the information that I got there. Okay. And all right. So now what we're going to do is go and check, and we're going to check your respiratory, your breathing. And what I want to do is to come to the back area here. Okay, I'm just going to scoot a little behind you. Okay. And what I want to do is to just check the symmetry of your thorax here and see, you know, if your the width of your waist here, you know, from front to back should be about half of the width from side to side, and yours is just fine there. Okay, and now what I'm going to do is to sort of push on the bones in your spine. And how does that feel? Do you have any pain with that?
No.
Okay. All right, I don't feel anything that's out of alignment there. Now what I want to do is to sort of check your kidneys back in here.
Okay.
And in order to do that, what I'm going to do is check what's called the costal vertebral angle. And this is the vertebrae going down this way, and this is your costal muscles here, and so we're going to check right in here. Okay, so what I need you to do is to tell me, does that hurt?
No.
Okay, let me try on this side. How about that?
No.
Oh good, that's to tell me whether or not your kidneys, if you're having any problems with that. Are you having any problems urinating, anything like that? Okay.
No.
All right, so now I'm going to listen to your breath sounds, okay? What I'd like you to do for me is to breathe in through your mouth, just, okay? All right, so go ahead, take a nice deep breath. Okay, again. And again. Once again. One more time. And one more time. Okay, and now that I'm in the back, I'm going to check the middle lobe of your lungs. So if you take one more deep breath for me. And one more time. You have really clear breath sounds there, so that's good. It's good to know that you're not having any problems with your breathing. I need to move around to the front here, and we're going to check your breath sounds again in the front. I'm going to need to pull this down just a little bit here if you want to, sort of hold that in there. I just need to have you once again take a deep breath for me. Out. There you go. And again. Okay, one more time. And once again. And one more time. And this is the last one. Okay, and we've already checked the middle lobe in there, so we don't have to do that again. And that all sounded really good. What I'd like to do now is to check your heart and see how your heart is doing, okay? So I'm going to go ahead and have you lie back here for me just a little bit. Okay, and if you can scoot your bottom out a little bit, we'll pull that out. Scoot back just a little bit. There you go. I don't want you to fall off the bed. There you go.
Sorry about that.
Okay, so what I'm going to do is listen to your pulse and your heart sounds. Okay, and what I'm listening for is, as the heart opens and closes, as the valves are opening and closing. Okay, so this is the aortic, and this is known as the pulmonic. Okay, and this is known as Erb's point. Okay, and then down here, right around the fourth intercostal space, is where the tricuspid valve is. And then the mitral valve is over here. Okay, then the last place I'm going to check here is what's called PMI, or the point of maximal impulse, and it's where you can hear your heart the most. And so we're going to go ahead and just listen to that. And you have a great heartbeat there. Okay, what I need to do is to just check those same sounds one more time with a different type of stethoscope. It's with a bell. The other stethoscope picked up high-pitched tones, and this one is going to pick up low-pitched tones, okay? Sure. So once again, we're going to listen to the aortic and the pulmonic and then Erb's point is at the third intercostal space, and then at the fourth intercostal space is the tricuspid, and then the mitral. And your heart sounds just great. Okay? All right. Okay.